think the biggest thing that they gave me at the HBCUs is a mind of giving, making sure I give back to the next generation and respect my elders and pay homage to those that have paved the way. And sometimes that can be lost in the shuffle of things when we're in our daily lives. And I've been making it intentional to reach out to former mentors, reach out, check on, see how things are going on, because those networks last forever. Like since I still work with the National Alumni Council, some of the Tougaloo alumni on there, like Joyce Dale, David Miller, they're in Texas. They will, if I'm out of hand, they will call Michael and say, well, Michael, you shouldn't have done this. Let's do it this way. Let's work on it that way. Or let's do that project. Or let me coach you through how we work through these barriers to make sure you're reaching the next level. Or if they can't do it, they point me in the right direction.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 36. Hi everyone, Omari Richards here. Thank you all for joining me. Definitely subscribe if you haven't as yet. Leave a comment, leave a like, share this with a friend. I appreciate you all a lot. I hope that 2021 is starting off well for everyone, and I'm just happy to be bringing you all more stories, more valuable content surrounded around public health, and I definitely have some more exciting things to come in the future. So just definitely stay tuned, and I look forward to sharing more. Just pay attention to the story and just how important in this story, how mentors and people who have been supportive of him have gotten him to where he is, because I think that's a big part in how he's gotten to where he is, and just how important it is to surround yourself around people who are going to push you and who are going to want you to reach those levels and see more than you see for yourself. So without further ado, here's today's episode. Today, we have a biologist turned public health expert with a strong command of healthcare administration, policy, strategy, and operations. He completed his Bachelors of Science in Biology at Tougaloo College. He was a Jackson Hart Study Scholar and went on to get his Master's of Public Health at Morehouse School of Medicine, where he was recently awarded top 10 under 40 for young alumni. Congratulations.
Thank you.
Yeah, you're welcome. After graduating from his MPH in 2019, he began his administration fellowship at Salem Health, where he currently works as the Service Line Business Supervisor. We have Michael J. Cleveland, MPH. Welcome to the show, Michael.
Hey, I'm happy to be here.
Yeah, I'm glad that we get to connect and you get to tell your story. I'm just really excited for this.
Yeah, so sorry to keep you up so late. It's 6 here, but 9 o'clock your time. But we're gonna make the magic happen. We're gonna make it work.
Yes, we will. Yes, we will. You know, we try to transcend all time zones and just tell good content no matter where you are, you know.
No matter.
Yeah, definitely. So how are you and how have you been coping during these times?
You know, I'm doing pretty good. When I first moved out here, the transition, all the clouds, all the rain, a little chilly, sometimes the snow, depending on where you're at. But after like a year and some change, I'm like, okay, I'm a Pacific Northwesterner. This is nothing. It's just a bit of rain. We're going to do things. But then with COVID-19, crazy, long, hectic days, but I've become like resilient. So I feel like this resiliency machine, like, bam, okay, nothing can stop me.
Well, I'm glad to hear that. It seems like you're making the best out of everything that's going on right now. So how do you identify, and then tell us a little bit about your personal background?
Okay. I did he, him, his, are my pronouns. I am originally from Natchez, Mississippi, where I was born and raised by my grandparents. After graduating from Natchez High, I went on to Tougaloo College. And then from Tougaloo College to Morehouse School of Medicine, I thought I was going to be like a cardiologist, but, God had other plans. I am a huge HBCU advocate. If anyone knows me, they know that I love my institution, Tougaloo College, and I love talking about other institutions. And I just enjoy like raising money and making sure students have the scholarship things going on. So, that's just a list summary about myself in like a little nut.
Yeah, awesome. Thank you for sharing that. I'm definitely gonna question you a little bit more about HBCUs and stuff going a little further. So, I guess when as we hop in here, like, what does public health mean to you?
So when I first started this public health journey, public health to me just meant like educating the general public about what's going on, making sure they're safe. But as I began to go deeper into what the public health tenets and everything that it means, I mean like, oh, public health is literally in each facet of our everyday life, like from our food in the restaurants to hospitals to, even safety in construction to, our environment. Public health is so much a part of us and we don't know it. So, my journey started like right there at Tougaloo, learning the basics, and I fell in love. And I knew, like, once I knew I wasn't become a doctor, I was like, I could still help out. I could still do my part to help bring African Americans where they need to be when it comes to science, medicine, policy, health in general. I knew public health was the route for me.
Okay, well, I'm glad that you found public health, or public health found you. I guess we'll find
It
out in a
found
little
me.
bit. Yeah, I feel like that is the key is for so many people in public health. So you got your Bachelors of Science in General Biology at Tougaloo College. So what was the thought process for getting this bachelor's?
So, like I said, I want to become a cardiologist. And if you know anything in Mississippi, you know about Tougaloo College. And if you want to become a medical doctor, Tougaloo College was the place to be. We have partnerships with Brown University, with a medical school in New York. Women's Brig Hospital. We just had partnerships across the nation. And they were like, oh, all the doctors, I think we produce over 40% of the doctors in Mississippi, 30% of the teachers, and around 25% of the lawyers in Mississippi. So I was like, hey, if I'm gonna really make this thing happen, I'm gonna go to Tougaloo. Got there, got to Tougaloo, started the courses, and I was freshman, 18 hours, taking those hardcore biology classes. And I was like, well, I don't know if this is meant to be. But nevertheless, I love Tougaloo and I flourished there. I met my mentors, and I was like, hey, I'm gonna stick through science. I know I want to do something science-based. And having this degree is just the first step in learning all about what science is, what life is all about, and the different facets that go with it.
Okay, awesome. So what about going into like the biology major, or didn't sit well with you, I guess?
Oh goodness, it was definitely the chemistry classes, organic chemistry,
Okay.
physics. And as I went on, I learned that I wasn't passionate about it.
Mhm.
So because I wasn't passionate, I was slumped, or I wouldn't try that hard. I wouldn't study. I would try to get extensions on assignments that probably wouldn't have took me that long. But the drive wasn't there to really pursue and go through with, all the way with biology after the degree. I was in the mind frame of, okay, until I find my passion these first couple of years, I'm gonna get this degree. I don't want them to talk about me, so I'm gonna go forth with it and try to see what I could do as a biologist. And yeah, hey, I may end up as a nurse or a doctor one day, but I always got these basic skills to fall back on.
Okay, awesome. Did you do a lot of lab work and like microbio and that kind of stuff during your undergrad, or not really?
Yes. Oh my goodness. First, one of the things that I was so excited about attending Tougaloo with and HBC was I had different classmates from high school who over the summer they would go home.
Hmm.
I would go home for maybe a week or two, and then I would be off to different labs or different sites. I was at Howard Hospital doing prostate cancer research through a veterans grant. I was like, okay, I'm literally a Southerner up here in DC doing hardcore lab work in the lab, 12 hours, running experiments. I was in Jackson doing lab work as well in our, making drugs for breast cancer and brain cancer when our phenomenal professors, Dr. Shari Walker. And I knew then, I was like, oh, I could do this, but do I have a passion for bench work, lab work? I was like, oh, every summer I have to do something. Every summer I have to be out there somewhere. I have to build my resume because I know as an African American and a male, I'm like, I can't just graduate and get a job. I can't depend on mom and pop resources. I have to start from the ground forward. And the best way is I have to be overqualified. They said the way I have to be overqualified. So that's it started there, and I was doing all type of stuff. The only regret is I didn't get a publication. I should have like drove home to get a publication.
Okay, and that makes a lot of sense. And so, what was like the thought process for you thinking that you have to become like overqualified? Like, when did this kind of like thinking come into place? Was this in high school? Was this junior undergrad? Like, what when was this?
I don't know when it actually happened, because the community I was around in Natchez, they were, they were African American leaders. They were doing the work in the community. They were a part of this, a part of that. And I guess I saw growing up, one of my mentors, Cressida Crawford, she was that lady to go to in Natchez. Like, she could do this, she could do anything she set her mind to. She was the one that taught us history, AP history. She was the one that taught us, like, you are who you are, embrace it. And I was like, okay, if I'm to get to her level, I have to go above and beyond. And then get to college and you see, like, you were a hot shot at high school, but got to college and like, I'm number 5, because all these people had A's and all these people had this. So I was like, I just see now, like, amongst this population, and I'm among, predominantly African Americans, I'm like, I see, like, how am I set myself apart? And by doing that, any opportunity, they knew, well, Michael's a part of this, Michael's a part of that. He's going to go do this, he's going to do that. I said, I was hungry. I was hungry for it. And I had that hustle about myself. Like, I got to add this on. And then when I add something on, it has to be beneficial to me. I wasn't just doing something just to do it. I did something that was truly beneficial to me. Like, I was a tour guide at Tougaloo. I was like, why you want to be a tour guide? Oh, this is going to help me with public speaking. This is going to help me bring in the next generation of students into my institution. And this is just it's going to help me set myself apart. Like, the next group of students coming in, like, oh, I remember he gave me my tour. I know I can trust him. I know he's going to give us the right advice.
Yeah, definitely. It seems like you've been thinking about like building those networks and taking up those experiences and opportunities when they're available to get the best experience and get the most out of your collegiate career.
Yes, yes.
Definitely. Okay, so you're a Jackson Hart Study Scholar. So what is this, and how did you get it?
Oh my God, I better not mess it up. They're going to get me if I do. So one of the main attractions to Tougaloo College is Jackson Hart Study. So Jackson Hart Study, they have several different levels of it. They have an undergrad, graduate, and the study itself. So the study itself is the largest epidemiological, I always mess this word up. Jackson Hart Study is the largest study of its kind that focuses on cardiovascular diseases among African Americans. Okay, this was a huge study funded by NIH, and it focused on, like, we know African Americans in Jackson have a problem. They are, and we're going to look at them holistically, from their physical weight to their genetic code, and we're going to figure out why are African Americans so predisposed to this condition. So part of that grant, some brilliant people wrote in, we want to train the next generation of public health leaders and medical doctors. And that's how the Jackson Hart Study Scholar Program started. So you come in freshman year trying to kill it to make sure you qualify to be a Jackson Hart Study Scholar. My year, 70 people applied. Okay, 12 get selected. I was like, ain't nowhere in the world I'm gonna make it. I don't know what happened. I ended up making it and becoming a scholar. And then in the scholar program, they began to teach you these graduate level skills, not undergrad, graduate. You begin to learn public health. You begin to do scientific article writing. You begin to do trips around the nation. Like, we went to Tuskegee to see the Bioethics Center. Your network expands. They expose you to doctors, everyone, and they provide you with opportunities to shadow. Like, if I wanted to be a cardiologist, they provided me with the opportunity to shadow a cardiologist. One of my sisters, she wanted to be a dentist. They made sure she was with the head of Mississippi's dental group. She was with her learning how to do things. So it was sort of this pathway of being like, hey, if you want to go into the medical STEM field, this is the program to go to. A great pipeline program, still going on to today. Still, producing leaders from there. And I think the best part, they paid me. They paid me to take classes. I say, wait, you gonna pay me to take classes? You gonna pay me to go and do this community outreach? You gonna pay me to shadow? You gonna pay me to go to these health fairs? And they're like, yeah. So I tell people from the start, my journey began in 2014 when I became a Jackson Hart Study Scholar. I say that's when my professional experience started. So from 2014 to 2021, I have 7 years of public health experience. I say because we were doing things that people from the 8 to 5 weren't even doing. We were really hustling and bustling. And special shout out to Dr. White, because she drilled into us like, hey, once you graduate, don't forget to reach back. Make sure the next generation of scholars have something going on. And the study itself has done tremendous things for the cardiovascular community. They have opened up the pathway of saying like, okay, we now have a group of participants that trust us, which was the hardest thing, getting their trust. And they know that we can help them. We will have huge celebrations where we brought on all the participants and celebrate them. And we would begin to do the studies on the data and information we collected. It was a primary study. And we would just go and say, pull out papers or do research. They're like, if you Google cardiovascular, Jackson Heart Study, or African American cardiovascular, Jackson Heart Study is most likely going to pop up as the database that they use to pull that information from.
Okay, that is awesome and a phenomenal experience. So tell me a little bit about the process to get there. You said there are different like Jackson Heart Study scholars for like undergrad, graduate, and whatnot. And you said it seemed like you applied for it. So was it you got it in your sophomore year or something like that, or how did that work out?
So the process begins I think it's the end of your freshman year or towards the end of your freshman year, and you start applying then, because the way the program goes is you apply your the end of your freshman year, and they start you over the summer helping out with the summer science program for in the children in the Jackson metro area. So part of that application was, okay, what classes are you taking? What is the GPA like? What are your teachers saying about you? How well you do in the interview? And this is like an interview where you're trying to be the CEO of a health system. They are grilling you. There's several different rounds you have to go through, your essay that you're writing. And because the 12 they pick are going to go there, they remind me of Talent Intent by W.D. Boys. So they're that group that's going to lead their class and going to the next level. So it was rigorous. Oh my goodness. And then I found myself after the process, I would coach the next group. I'm like, okay, I know who's going to make it, who's not going to make it, who has the best, who's really hungry for it. And let's see if we can get them to make it to this select group. And the best part is that even though you're not a Jackson Heart Study Scholar, you can still take the Jackson Heart Study Scholar courses. And because of Jackson Heart Study, we now have a program where you go to Brown University for your MPH, totally free. I was so jealous of this program. I'm like, I didn't spend all this money and I could have just did this pipeline. So, it was very rigorous. And for the graduate level, it's pretty much the same thing. And it's partnered with Jackson State University, and they pay for your MPH going through that program.
Okay, that's awesome. So I know a little bit before we said that you like public health came across to you. So was this the experience that opened you up to public health and made you like realize that this is a field that you can work in and you can help people with?
Absolutely. Like Jackson Heart Study planted the seed, and over the next 3 years, they watered it and tended it and they prayed over it and they created this monster. But it definitely began there. And I fell in love with the community. I'm like, to see people who look like my grandparents, mom, dad, brother, sister, and we're doing this work, we're informing them, we're letting them know what's going on. It all started at JHS.
Okay, that is awesome. And that's awesome that they have that program to open people up to public health, because I feel like so many people go into school as like biology majors wanting to be a doctor because that's all they know, and they don't know public health is a viable option. So that is great that they are creating that pipeline for people to do that kind of work.
Most definitely, and they when they start off with the classes, you begin the basic public health, and then they build off it from there and go from there. Currently I guest lecture there as health policy, healthcare administration, trying to bring in that piece. I say, you know what we're missing from this pipeline, this train, we're missing that healthcare, that policy piece, and this is what they need to, policy dictates everything. I say, okay, we need to make sure the next generation of policymakers know what's going on. So, yeah, I get excited about JHS. You got to forgive me.
No, no, you are absolutely fine. It's definitely something that seems that you should be excited for, and you should be like talking about it to let people know that it is an option, and it has helped you so much in your career so far. So that is awesome. And I definitely want to talk a little bit about more about like you said mentorship or teaching that you're doing, but we'll talk a little bit about that a little later. I wrote down a note there. So you did a Western Regional Director for UNCF National Alumni Council. So what is this?
So, a part of if you're a part of the United Negro College Fund, and there are like 30 plus institutions part of the United Negro College Fund. Tougaloo College is one. They have on campus called Pre-Alumni. So the Pre-Alumni Council is designed to have a group of students come in and they learn all about what it is to be alumni, how to give back. They learn leadership skills, resume, networking, meeting current alumni. And a part of the pre-alumni is the National Alumni Association. So the National Alumni Council is an affiliate, close member with the United Negro College Fund. So they're our parent body. We go through them for everything. And I began in pre-alumni council as a Southwestern regional rep. So I represented 9 schools in the Southwest. We did the first conference they've ever done in like 10 years. And from there, I began to work with the National Alumni Council. I was on their planning committee for conference. I was on their workshop committees. I was like, okay, I was helping out because I saw what they were doing and loved it. And then it came to a time where I was in Atlanta and it was time for conference. They needed a Southwestern regional, they needed a Southern regional rep for, not Southern, they needed a Southeast regional rep for NAC. And I say, well, I'm in Atlanta. I know what's going on. I have affiliation with UNCF. I can do the work. So I did a year of that. I did 2 years of that, of, putting strategic plans together, meeting with alumni, spreading awareness about UNCF schools. And then my journey when I got the administration fellowship here, they needed a Western regional rep, and I was elected to that position as well. So here I work closely with the Seattle office, Las Vegas office, and Los Angeles office, and Portland office on spreading the awareness of HBCUs, spreading, raising scholarship dollars, and letting students in the Pacific Northwest and along the West Coast know, like, there are institutions out there where people look like you, where they can teach you your heritage, and you can go for a full ride. I went to Tougaloo on a full ride. And part of all that work with the National Alumni Council, I became one of the co-advisors to the National Pre-Alumni Council. So, that startup, that the mentorship stuff that we'll go into later on. But it's been a journey with this because it has taught me leadership skills. It has taught me that how to bridge the old guard and the new guard. I call the elder saints or the elder alumni, the old guard, and the new generation of my generation, the new ones. It's taught me to bridge those groups together, which is very difficult. Oh my goodness, very difficult. But we're seeing progress. I've been at this for 5 years. I've been part of the board for around 5 years, and it has been a thrilling ride. And for anyone out there, if you're looking to get involved with the United Negro College Fund, the inter-alumni councils or national alumni councils can definitely help you out. And you can just let me know, and I can ping you to the right person to help us out.
Yeah, definitely. So definitely hit up Michael if you are interested in that. He'll be more than happy to help you along that path. So before we go into, so you got your master's of public health at Morehouse School of Medicine. I know you wanted to talk. Okay, well, before I ask this, so when did you know that you wanted to do like a master's of public health?
It was, I was having an advisor with one of my mentors, Dr. Wendy White, and I was like, I don't want to do medical school. I got approved to do Teach for America, so I was getting ready to do Teach for America.
Mm-hmm.
I said, but I don't know if my heart is truly into Teach for America. And I say, and she just broke it down to me. She said, okay, so what do you like? And we began to go through the process, and she realized, she was like, well, this is what you want to do, a master's of public health. I said, well, are you sure? So we began to talk about the careers and what goes on through it. And, she introduced me to different people in the field. And I was like, well, yes, I did an summer internship at Morehouse College. It's called Project Imhotep. I spent an entire summer with DeKalb County Board of Health, And I learned from health administration or administration, public health administration, I learned like what's going on. Like this is what we do to make the magic happen for the community. And I fell in love with the administration piece. I was energized by seeing those people work in DeKalb County. Oh, did I say DeKalb? I meant DeKalb, y'all. Don't get mad at me. DeKalb. I know how to say it. DeKalb County. And then from that relationship at Project Imhotep, I did a great job there. I kept in contact with the dean of Morehouse School of Medicine's Master in Public Health program, Dr. Miles Richardson. And I said, well, if I do this thing, I want to go to a school that is focused on community health. And I say, if you want to do a school that's truly focused on community health, Morehouse School of Medicine is that school. I say, a lot of people try to talk to me about rankings and this and that. I said, well, they're nationally ranked for community health. They're nationally ranked for this, this, and that. I said, they have the same brand and recognition as you all would say Emory or GW or all the other schools. I say, and I know if I go here, not only am I going to get the knowledge, I'm going to get real world experience. And literally, I got that real world experience. So that my journey began there with my mentor breaking it down to me and help guiding, coaching me to where I reached that revelation. And I did some more research and some more shadowing. And I realized I'm like, yes, public health is where I want to be at.
Okay, and that's awesome that you had someone that you can talk that through and figure out, okay, this is a good pathway for me to do. And like, because I know sometimes it can be hazy for us, like when we're just thinking, especially when these are like big life decisions. I feel like so that's awesome. So going back to my question that I was going to ask is, so you went to two HBCUs, and I know you wanted to talk about the importance of HBCUs and what it means for you and your career. And I feel like you just seem very energized around HBCUs. So I just want to give you space to talk about that, and I'll just ask questions if anything comes up along the way.
Oh, HBCUs, they are such an integral part of our nation. There are a lot of times there are debates between HBCUs, PWIs, and I disregard them totally. I say I went to an institution that was built for me when the institutions that you went to didn't even want you there. I say I'm going to an institution where they're going to nurture, guide me, and make sure I have the skill set to do what I have to do. You know, sometimes people are like, oh, your HBCU, we don't even know what it's called. I say, you might not know about Tougaloo, but you see Tougaloo. You see me. Okay, and you respect me when I walk into this room and command the attention. So the passion for the HBCU started in high school. You know, at first I was one of them naysayers, like, I'm not going to no Tougaloo. I'm not going to Tougaloo. I don't know what that is. I stepped on the campus and I saw Tougaloo and I said, this place for me. I don't need to go nowhere else. I don't need to see nothing else. This is it. So, and I realized that the HBCUs, what they're providing to, I come from a very not poor, but lower socioeconomic status family. You know, my lunches were paid for by the government. We didn't have food stamps. I wish we had food stamps, but we didn't have food stamps. But you know, we had what we needed, but we weren't well off. And the HBCU came in and paid for my entire college. And I said, well, I see why these institutions are around. So when I look at like HBCUs and how they're treated, sometimes you have a group of African Americans and the society that looks at HBCUs and says they're worthless. When in actuality, we have produced majority of the judges, doctors, dentists, nurses. We are those that are African American or minorities, we are producing them. So it was without a doubt, I was like, okay, if I'm going for a master's, I'm going to an HBCU. I'm ready for that public health, that professional experience, and I'm going to somewhere where I know they're going to nurture me, but they're also going to kick me out the nest. And most people think they coddle you. They don't coddle you. If anyone been through Morehouse's Masters of Public Health program, they know they do not coddle you. They send you through the ringer. We had to do a practicum, thesis, exit exam. We were doing everything triple what other institutions didn't have to do, who only had to do one thing to get out. And HBCUs have provided this safe space for our community for so long. You know, I think now that other institutions or other spaces, even in corporate America, are on this diversity and inclusion wave, or now becoming more accepting, we are tending to forget the institutions and the safe spaces that were there from us from the beginning. And because of that, we're starting to see some of our institutions close, and that's very unfortunate. So I have become a driver for, if you want to give money, oh, well, I know a list of schools, or I know an organization you can give to. There's Thurgood Marshall, there's United Negro College Fund. There, if you really want to be good to me, get a Tougaloo College, just tell them I sent you and give the money there. So the HBCU world, it's growing. It's a growing, bustling world. It is still relevant. There are still people out there who are producing phenomenal alumni. Like, all the time I think to myself, am I truly doing what I'm meant to do? And I reflect on my HBCU journey. I'm like, yes, I am. They have prepared me. They have driven me. I see, I have colleagues that went to PWIs, and we look at their journey. I said, oh, our journeys are a little different. Hate to say it, but our journeys are a little different. I'm a little more okay about myself when I enter a room that doesn't look like me. I know what stats or, projects to bring to the table. I do know how to turn on that professional, that code switch, and how to, navigate the room and play the part. So, that my love for, I love them. I truly love, especially my own Tougaloo and Morehouse School of Medicine. I love the institutions. I love what they're doing, and they're still producing phenomenal alumni. And we do not want to forget that.
Yeah, absolutely. And I'm glad that you have that passion, and that you are pushing to keep those institutions alive and just keep it at the forefront of people's minds. So do you think that the relationships that you build in the HBCU have been like very beneficial to you right now, and has, like, do you think they've like molded your mindset as well as going in? Because you spoke about like code switching, and like for me, I grew up in a completely different context from most of the people here. Like I was in Trinidad, I went to the Middle East, I was in a class with predominantly white people, so I've been in those situations where I've like gotten used to it, and I didn't really think about it until like I've had these kinds of conversations with different people, and then I realized, oh, okay, I know like how to play this kind of like corporate game, or whatever you want to call it, you know what you mean. So I don't know, just talk a little bit about that, if I don't know, I just mumbling a little bit there.
Well, no, they truly, my family and God helped set the foundation and are the cornerstone, but going to HBCU helped build in that foundation and build the rest of the house. So they have molded, I like to say, I am a person where I give people their flowers when they're due. I show appreciation to my mentors. I keep them updated about what's going on. And the network has definitely helped me out so much. When I first moved to Atlanta, and I told Tougaloo Alumni Association that, hey, I'm going to Atlanta. I told my UNCF and NAC counterparts that I'm coming to Atlanta. Without a doubt, booming recognition was coming in. Like, hey, if you need a place to stay, you can get settled in our basement. We know this place, we know that place. Do you need money? Do you need groceries? Do you need toiletries? Hey, you're going to public health. Well, let me introduce you to this person that works at CDC, or this person that's at the school that can look out for you. Like, hey, let's meet up for lunch. And so they created that, family away from family for me. And it has had, I want to do that for the people after me. If there was someone right now that graduated from HBCU that's up here, in Oregon, I'd be like, well, come on, these are the ins and outs. And they did it to me. Why shouldn't I do it to you? So those type of things coming up. And I think the biggest thing that they gave me at the HBCUs is a mind of giving, making sure I give back to the next generation and respect my elders and pay homage to those that have paved the way. And sometimes that can be lost in the shuffle of things when we're in our daily lives. And I've been making it intentional to reach out to former mentors, reach out, check on, see how things are going on, because those networks last forever. Like since I still work with the National Alumni Council, some of the Tougaloo alumni on there, like Joyce Dale, David Miller, they're in Texas. They will, if I'm out of hand, they will call Michael and say, well, Michael, you shouldn't have done this. Let's do it this way. Let's work on it that way. Or let's do that project. Or let me coach you through how we work through these barriers to make sure you're reaching the next level. Or if they can't do it, they point me in the right direction.
Okay. Awesome. All right. So you're getting your MPH at Morehouse School of Medicine. Do you have a concentration?
So Morehouse School of Medicine, we're like, oh my goodness, right before I left, that's when they broke our concentration. but they're a general public health program. But I took classes that focus on health policy and healthcare administration. You know, I took strategic planning classes. I took like anything I knew I would need as a skill set for leadership and for working in this industry, I was taking. I knew I didn't have a love for epidemiology. I sure ain't have a love. I'm saying sure for Southerners. I sure ain't have a love for biostat. And I found my niche in health policy and healthcare administration. I used to think it would be me doing health education. Two things stopped me. The first was when I started, like when you're in Morehouse, second, third week, you're in the community. You're educating, you're doing stuff, you're doing that. I was like, oh, I don't think I'm built for this. The third thing is I saw how much health educators make. I said, okay. Shout out to my health educators. I appreciate you. Let me know if y'all got a donation or something going on because I feel for you. And I said, well, no, I want to make sure I break those generational barriers and provide wealth for my family that I have. I say I need to do things that are going to set me up long term, and I can still do that health education piece in this healthcare, health policy administration world, which I still bring in. We have meetings all the time around population health, and we're discussing things. And I'm like, well, I know this won't work. And they ask, well, how? Because I lived it. I'll say for the everyday man or person, you can't just say like, oh, gym memberships. I said, well, how are we going to get to the gym memberships? What if they work 3 or 4 jobs? What if they got kids? Who's going to watch the kids? Are you going to hire a trainer? Are we going to, what are these other things that come into place? I said, well, no, we have to think of out of the box when we're doing our population health work. So, and it's been at Morehouse School of Medicine was a wonderful place to be. Taught me a lot of things. Winston hit on it a little, like, hey, they are heavy focus on medical students, but part of the mission when I was there was, I was like, well, hey, it's more than just medical students. There are MPH. I was the one that was hanging around the Alumni Association and the alumni director. I say, these are the people giving money. If I know that these are the people that are giving money, I'm gonna go talk to them about the MPH program. I'm gonna come to their events. I'm gonna say, well, don't forget about us. We wear blue coats. You know, they have white coats for doctors and PhDs. I say, I'm gonna come in with my blue blazer and tell you about the MPH program and why you should give and why our money and why giving to us is just as important as giving to the medical students. That was a long way of saying my concentration. I was like, we got there a little.
I love it. I love it though. But I think that that's so important though, because you think about like the return on investment, I guess, and you definitely have to consider that, especially where you're coming from, and if you want to give to, like, especially when you're Black, it's not just you have to give to. You have to give to your family, your brothers, your sisters. Like it's a bigger network that you have to give to. So really thinking about how can you sustain that, give back in a way, as well as do the things, because you can always do the health education part, or you can add it into what you're doing, but like maybe having something that's a little more sustainable, and then adding that in. I think is a very smart viewpoint to take on that. So you were a graduate administrative consultant for Morehouse Choice ACOE. So what is Morehouse Choice ACOE first of all, and then how do you get it?
Oh my goodness. So part of our practicum at the school, they sort of like let us choose what route. I did not play any games. I said, well, hey, if I'm doing practicum, I want a healthcare centered or policy centered. I don't want none of this other stuff. I want something that's going to make me marketable for fellowships and is going to get my feet wet to see if I really want to do healthcare administration or work with health systems. And Morehouse Choice was one of our partner groups, and great leadership, great, organization that they have. And they are ACO, which is Accountable Care Organization. It's sort of similar to the CCO. And this Accountable Care Organization was one of the largest in Georgia. They had over 40 plus clinics or health systems or, different partners involved. And what they do is they help drive the social determinants change. They also help the clinics or the organizations mimic the highest reimbursements they can get from Medicare and Medicaid. And they sort of put them on a standard track to say like, hey, if you're a part of our accountable care organization, we're going to make sure that you hit these metrics, that you're a part of this central network, that you help feed off of each other. And we're going to do our part to help make sure your patients are aware of what they need to do to come to their annual wellness visits, to fill out the social determinant of health, survey, to, check in, pick up their medications. And the thing about Morehouse Choice Accountable Care Organization is that it's one of a kind. It's one of the only ones in the nation that focuses solely on a minority population. Okay. And there are CCOs around the world, around the nation, or accountable organizations around the nation, and they do different things and cater to different things. And, bottom line in healthcare, bottom line is the money. So we're going to make sure you have the largest reimbursement you can while also increasing the quality of care that is going through your clinics. And that's what the Accountable Care Organization came through. And I called myself a consultant because I was like, well, I'm using what I learned from my, at that point, 5 years of public health knowledge and 2 years of being in the program to create a social determinant or a social determinant of health survey where increase the validity of the social determinant health survey and create a culture sensitivity training program for their doctors and providers to say like, hey, if I interact with if I'm a Caucasian doctor and I interact with a Muslim patient, I need to be aware of what I say and how it impacts them. So I created that. I created what they call a trust program. I call it Trust. And I essentially laid out the basic fundamentals, what you need to have in a culture sensitivity program. And I developed a sort of a one-day crasher basic program to say like, hey, if I do this, I'll become more socially aware and conscious. And I would start to see my own biasness. One thing about me, I start to see my own bias. It's like, oh, I'm biased toward people that wear flags. I automatically think they racist. Maybe they're not racist. Maybe they're just in the army or something. So, those type of things begin to come up. And from that program, I learned so much because the CEO, Michelle Brown, she was a former VP for Blue Cross Blue Shield. She led the program. She taught me and a few others about what it means to actually be an executive, and not only an executive, an African-American executive in a space, and what you need to do to get the ball running and hit the metrics and hit the quality of care things that you need to do, and how you partner and work with organizations such as the Center for Medicaid and Medicare Services and the local public health department and all these different healthcare systems. Because when she took over, they were around 10, but because of her guidance, it grew exponentially to over 40 plus clinics and systems that they're a part of. So that was one of my first real journeys into healthcare administration. And I know it played a significant role in me becoming a fellow.
Yeah, and to that point, so I was going to ask, when did you know about like health administration fellowships? Like, because for me, like I didn't find out about those kinds of opportunities like until a year into my MPH program, when I was like really digging in to see what I could do afterwards. So when did that come up for you?
So it started for me with once again, oh my goodness, you're gonna get tired of me saying the word mentors, but I believe in people pouring into my cup. And my cup can't run dry because they instead of pouring their knowledge and wealth into me. Dr. Renetta Waldrop. So Dr. Renetta Waldrop is our health policy and healthcare administration chair at the school. And she led the classes, she led the work. She's a former administrator for Fulton County. She's a former executive member at Grady Healthcare System. So she was that lady, she was the person to go. And I began to talk to her like, hey, I don't want to get my PhD right now because I know I don't want to go out there and get my PhD and I have no other experience besides what we have going on now. I want to really dive into this. And she brought up healthcare administration fellowships. So I began to do a little research over the summer. I'm like, I don't know. We'll see how it goes. And she guided me and Winston through the process of like, this is what you do for your package. She did mock interviews. She wrote letters of recommendations. I applied to, no lie, like 13 programs. I was applying to 13 programs. She made each and every letter personal to those programs. And I felt like, oh my goodness, this is a person that has my back who wants me to become that leader. And I dove into that world. I said, if I'm serious about healthcare and I don't want to start from the bottom, I have to do a fellowship. And a fellowship is that fast track to leadership or C-suite status. I said, I have to do a fellowship. I don't want to start off as, down there, front line. I want to go in, learn as much as I can, and getting the full experience of what it means. And that's how the journey started. And to this day, she still checks on me. Still, if I need something, she's just a call away, or need advice, they come in. So that's how the health administration journey started. And I tell people, I applied to 12. You just need one yes. People that my classmates used to laugh at me. They were like, what if you end up in Timbuktu? I said, I'm going to Timbuktu. And that's how I ended up in Salem, in Salem, Oregon. I said, well, I'm applying everywhere. I had 11 no's. I didn't even make it to a phone interview, except for 2. I had a phone interview in Arizona and a phone interview in Salem. And I said, well, Lord, if it's meant to be, it was meant to be. Anyone that knows me, I have plan A through Z. I say, if I don't get a healthcare administration fellowship, I am on track at Morehouse College Public Health Institute. I'm on track to become a manager for 2 of their grants. So I was like, okay, if it don't work out, I always got this follow-up on. So, and then it came to Salem Health, and I got on site. Banner Health, they told me, nah, you ain't gonna make it, bro. You ain't gonna make it, bro. Salem Health said, well, come on site. So I say, Lord, I'm in the middle of writing my thesis. It's February. I got to present in the next week. I say, but my mentor said, well, go. I went, and I was very candid in my interview. I said, I have to see if this organization is going to work for me, work environment. I would sneak off, like while the other candidates were doing other things, I would sneak off and talk to the janitors or EVS staff. I would talk off to administrative assistants. I would talk to nurses. I would see, like, well, how do they treat you all, to get a sense of what the organization has going on. In my interview, I'll never forget it. It was an interview with the former fellows. And they said, well, Michael, you can relax. You can, just be yourself. I said, no, I can't. I said, just like y'all interviewing me, I'm interviewing you. I said, out of all the other candidates, I have the most to lose. I have the most that I'm giving up. And I transitioned that interview into me asking them questions around. I did my research. I say, one was diversity and inclusion. One was at a clinic. One was a clinic manager over sleep. With the former fellow, I was drilling them on, like, so what's really going on? Will I have a job after this fellowship? What are you doing in your workspace to make it more of equitable for us, for people that look like me? What are you doing to improve resiliency and employee engagement in your office? What is the primary care market? How much of it does Salem Health hold? And I said, Lord, I can agree with these people, they ain't gonna tell me. And then lo and behold, it all worked out. The real meeting was the dinner. No lie. The real meeting was the dinner the night before all the other interviews. Got to the, dressed in my tux. The HBCU taught me, you're going to come professional. I'm dressed in my tux. I make sure it's right. And I picked a seat. I was strategic. I said, I'm going to pick a seat where people can sit beside me. I'm not at the head. I'm not by the side. I'm not sitting by any of the other fellows. I'm in a seat where I can do a dual thing and not control the conversation, but still be a part of it. And so heartily, I sat by one of the managers and the chief medical officer. And me and the chief medical officer hit it off. We started, I used to play the cello. We started talking about the cello. We started talking about, all type of different things. Me and the clinic managers talking about like tennis and working out and other type of stuff. And it was a nice, wholesome conversation. And I was like, oh, I didn't get FaceTime or conversation time with the COO who we reported to. I didn't get time with this person or that person or this. And what was so funny is at the table, they brought up a CCO. And I said, oh, I know about a CCO. I'm doing an ACO. I'm doing an ACO. It's the same thing. So I begin to engage them in that conversation. I say, so we don't pay our providers. So they're like, oh, we pay our providers. We're doing this one, that. Well, have you tried this? Have you tried that? And I was like, oh, I set myself apart. And it worked out so happily. After the interview, I flew back and I was like, you know what? They're going to pick people that are local. I'm not going to get this. And they called me on Valentine's Day to say like, boom, you got it. I was like, ah! I was like, oh, and I was like, so are you coming? I said, yes. They said, you don't want no time to think about it? I said, no, I made up in my mind wherever this fellowship is, because I need you all, wherever it is, I'm going. Mm-hmm. And I made that career sacrifice and that social sacrifice. And I packed up my life and I came to Oregon. That was a long way of saying how I found out. I found out about health administrations, but I am so excited I did.
Yeah, and I feel like there's a lot in there. So definitely there was a lot of value from your mentor for her to go through and individually write those letters of recommendation. That means she definitely has your back, and that is an awesome feeling to have, to just have that support and have that person there who is going to be there for you. I played a little bit of cello, actually. I played cello for
come on. The vibrato used to get me a lot. The vibrato, I used to joke around. I'm like, I'm third chair of 3. They're like, what? Huh? You last chair, huh? I said third chair, but yeah. Did you enjoy? What was your favorite piece?
Oh, I haven't played cello in years. Really put me on the spot here.
What?
I enjoyed playing Pirates of the Caribbean.
Okay.
Yeah, that was
okay.
To play. Yeah.
I don't play as much now, but my favorite piece to this day is Beethoven's Symphony No. 9. Okay. First symphony ever to have choral music with it, and I don't know what it does to me, or when I play it, or now when I'm stressed out, I play it and it just soothes me. Mm-hmm. I'm like, and I listen to the entire thing. That thing is long, and it just does something to me. So yeah.
Yeah, awesome. That's definitely awesome. Yeah. So you're saying that you needed this opportunity just as much as they needed it, and this interview was just as much an interview for them as it was for you. And I think that's important. People kind of like underplay how important it is for you to go in there of interest and like asking relevant questions that actually get them thinking and saying, okay, this guy can be someone that's definitely going to be a thought leader, is going to speak about things that are important and things like that. And I think it's like I'm very similar to you in the sense that when I got the call back for my fellowship, I was like, yes, I'm accepting it. And I went to Alaska, like never in my life did I think I'd go to Alaska. So I think like when these sorts of opportunities come by, it's like, you can't just like throw it away, because if I didn't go to Alaska, I wouldn't be where I am right now. And I think that has been so beneficial to my career. So just jumping back a little bit to your MPH, I just so I know you were a top 10 under 40 for young alumni. So how did this come about for Morehouse College of Medicine?
I was totally shocked by it. So I have an amazing group of friends. And I have to do a special shout out to Victoria Pittman and Dr. Lakeisha Tables, who were both in the cohort with me. And they saw in me something I didn't see. So sometimes as a Black executive leader or a Black leader or a Black person that's trying to make a move, you suffer from imposter syndrome. You think what you have going on is not enough. And you think like, oh no, I need to do more, or like, I'm not worthy of this. So they begin to probe me and ask me questions about certain things in my journey. I'm like, what are y'all doing? And they submitted me to be part of the nomination. And there were over, I think, 70 plus nominations. And I was, once I found out, I'm like, oh, I'm not going to get it. I'm fresh 2019. I'm fresh out. This is the second class of top 10 under 40. Mm-hmm. And I'm like, they're not going to, I still got some more stuff to get under my belt. And the program came around, and the dean, Dr. VMR, we call her, she announced my name. I'm like, Michael? I was like, me? She said my name, and I was truly shocked and humbled, because I didn't realize everything that I was doing. And then I looked around like, I'm the only male. Out of these 10, I'm the only male. And I was like, that's even more to be a recent grad. But my friends, they sat me down and they say, well, no, let's do some affirmations. Let me tell you who Michael J. Cleveland is, because I always joke around like Michael J. Cleveland is a brand. You know, when you say Michael Cleveland, you're talking about my dad. When you say Michael J. Cleveland, you're talking about the healthcare, the public health advocate, the HBCU advocate, the man that's going to run his mouth, you know, the mouth of the South. You're talking about him. So they say, well, Michael, look at it this way. You're on 3 national boards. You're on the Tougaloo College National Alumni Association. I'm a regional rep there as well. You're on the National Alumni Association. You're a board member part of the Excel Leader, which is a group that trains the next generation of political leaders from HBCUs and provide leadership trainings to SGA members, and they do presentations, and they're doing phenomenal work. They say you're a board member here, and not only that, you're active in the local community. You know, help out with the NAACP. You're part of this smart reading program, and you're not only just a title. You know, it's not just a title. You're doing meaningful work. Like, you're making progress on this stuff. You're making actions happen. And I say, and you were for your fellowship, you're the first African American. Like, you know, out of the 10 plus years, you're the first African American to come through this program. That's phenomenal stuff. And I was like, well, you know, imposter syndrome kick in. And you're like, well, I don't think so. And their affirmation and then getting an award, like, okay, Michael, you do have these things going on. You do have, your network is growing. Your brand is starting to formulate. You know, they're knowing you even around work. You know, they're starting to say like, oh, if we want to know something around diversity and inclusion, we know one person that's going to be real candid. And that's Michael J. Cleveland. He's going to be real candid. And I started to embrace that. I'm starting to embrace that. So I'm still humbled by it. You know, the trophy came in the other day, and I'm just like, wow, I'm part of the second class of top 10 under 40. Like, oh my goodness, it's just so awing. And, you know, I'm still humbled. I'm so grateful to my alma mater for even, you know, picking me. I'm like, wow, you know, so yeah.
Yeah, that's awesome. Congratulations. And that definitely does mean that you've been doing a lot of meaningful work. And I think also it goes to show that you have those friends and those colleagues that are supportive and they want the best from you, and they're seeing more of what you're doing than sometimes we can see for ourselves. And I think that's really a blessing to have. So that is awesome. So talking about your administrative fellowship at Salem Health, so what do you do in your role?
Oh my goodness! So
and before I go into that, is it a 12-month fellowship or a 24-month fellowship?
12 months.
12 months. Okay.
12 months. So well, this normally under normal conditions is a 12-month fellowship. This time around it was extended a little longer. I think I got like maybe additional 2 or 3 months out of it. And the purpose of like I said in the beginning, the purpose of the fellowship is fast track the leadership. Now, for those of you all that are interested in a healthcare administration fellowship, I'm gonna let you know, when you come in there, though the other leaders in there, sometimes if they're like supervisor or frontline staff learning to go up a level, they see you as a threat. Like, why are you bringing in this person? You know, and the purpose of a fellowship is also to bring in new, fresh eyes, a new, fresh skill set to see things that they didn't see as executive leadership. So you're seen as a threat sometimes, but you have the confidence of the executive leadership. And I chose this program because some programs you have this, you have a finance track, a strategy track, operations, supply, all that. Salem Health was a little different. They said like, okay, we're going to do like, we're going to give you different projects from different areas. And as time goes on and you find your niche, we're going to let you pursue more projects in that area. And that was perfect for me. In my interview, I let them know like, hey, I might not know everything, but I'm hungry to learn. They asked the question like, what are you seeing out of this? I say, well, I'm a blank canvas and I want the organization to help me paint my picture of what I want to be in healthcare administration. And so I started on different projects. One of the first one was employee engagement in our lab and imaging system, which was an all-time low. And we were working on increasing that employee engagement because when employees have a higher dissatisfaction, that impacts our quality of care. And it also increases our turnaround and decreases our retention. And because of that, it's like a landslide of other things. So I started working on that project, and we began to implement things, and the morale and the things around the departments improved. And then I moved on to our population health work of seeing like, where does Salem Health stand? And I had to be clear and let them know, like, hey, where does Salem Health stand? Where does the health department stand? I'm like, okay, y'all, let's not do health department work, because we can partner with the health department to do this work and not waste our resources. So we began to do our roadmap to where Salem Health took a serious stand on population health, where we're going to go from there. And then it morphed into, I became the project lead for an opioid conference for the entire state. And they gave me a challenge. Like we had a giant grant. The money needed to be spent by a certain time period. You know how I go. And they said, well, Michael, you have around 4 months. I said, okay. Oh, all right. The HBCU thing kicking in. I said, okay, all right. What's going on? So I began to assess the project. And when you get a lot of educated people in the room, you get a lot of talking, no action. Once they made me the lead of it, I said, well, no, we cutting all that out. These are actionable items I need to have. We're going to do sponsors. Here is the sponsorship packet. Here is the goal. Here is how much we want to do. Here is the speakers we're going to invite. I need you all to vote on this. I need this, that. No, we not. And I used to we're not going backwards. We already voted. I'm not going back. I don't have time to go back. So I began to assert myself, and they saw a different part of the fellow. Most fellows would just do a yes man or a yes lady. I said, I'm not a yes man. I'm not a yes lady. If you wanted that, just let me know this not going to work out, and I go back to Mississippi. But they started to see like, okay, what he's doing is making progress. But then COVID-19 hit, and the conference was canceled. I'm like, months of work. Like I had months of work went down the drain. Damn. But then another opportunity presented itself as the COVID-19 screening administrator for the system. So Salem Health has around 450 beds, a rural hospital site, and 13 clinics. And I was in charge of screening for the entire system. We had a baseline. Things weren't going like they should have. And that's when they brought me in. And a lot of people were afraid. They were like, he's not going to be able to handle it. And I was like, oh no, you all know fellow Michael, not manager Michael or administrator Michael. And it switched, like that code switch, it switched. And I slowly began, first thing I did was observe. The first week or two I observed. I'm here to see what's going on, what's the current state. And then slowly but surely, with the help of the team, because I'm a collaborative coaching leader, help of the team, we implemented changes and we began to standardize things. I used to get all type of things like this department wanted this department wanted that. And I would be like, no, it's a different rodeo. I understand how they went before me, but that's not how this is going to go now. We standardized the process. We got it efficient. And we identified like, hey, we're returning to normal. And the people we're using as screeners, we now have to bring in this contracting company. So I helped with the merge of the contracting company and bringing those in. And I felt like my fellowship became alive once I became the COVID-19 screening administrator, because I knew it the back of my hand. I knew the policies, the regulations, what staffing, the hours. I knew it all, how much money I was spending. I knew literally every piece and every facet of it. And that role taught me like, okay, Michael, you can be that leader here, which led to me to saying like, okay, I understand this COVID-19 screening administrator, but COVID-19 won't be around forever. I need something permanent, which led into me becoming it's sort of a dual role of research, clinical trial research, and oncology supervisor and a business manager. And they created the Service Line Business Supervisor role, where I help with oncology and cardiac with financial businesses and supervise the research team there. So it's been an experience. It's like everyone's experience in a fellowship is different. Mine was a roller coaster. When I first came in, I was scared. I was scared of saying the wrong thing. I was scared of messing up. I was scared of like being called out or being called dumb, because most of the time I'm the only black man. Not only am I the only black man, but I'm the youngest in the room. So I'm like, Lord, and that's a threat to certain areas. And even not to C-suite or, other, but to certain managers and supervisors, it's a threat. And I used to have conflicts with them, and I'm like, hey, what can we do to solve this? I'm not a threat. I want to learn from you. I'm not here to take your job, okay? I'm here to learn, so are you gonna pour into me, or do I have to go find someone else? So, and one advice I give to people is, once I truly stepped into the purpose of this fellowship is when I was no longer afraid of being fired or not finding a job in the health system. Once I gained that confidence back in myself, and I'm like, I'm Michael J. Cleveland. Once I gained that confidence, I said, well, okay, this is who you're going to get. This is who you all have made over the last 6 months. This is the person. And it skyrocketed from there.
Okay, awesome. So is this Service Line Business Supervisor, Tim, is this like a full-time position?
Yes. So full-time, I started in, I was interim in around August. I was interim. I was doing that role plus screening. So I was doing two huge things at one time, which is expected of a fellow. Don't get me wrong. It's expected of a fellow because it's like the CEO likes to call it a boot camp. And I said, yes, it's a boot camp and I want to survive. So I was doing both roles. And then as time went on, they were like, okay, Mike, we want to make you permanent. I said, okay, if I become permanent, I can no longer do screening. So we began to find a replacement and transition that off and fully do this role right here.
Okay, so that process moving from fellowship to full-time was pretty seamless.
It was, administrative wise, yes. Mentally, it's a little different because you go from being in the know and the executive sessions and this to that to one of the middle management. Mm-hmm. And it changes your perspective on things. But I knew ahead of time. I was like, well, I know I can't just go to the CEO or the VP of Human Resources or the Chief Communication Officer or the CEO like that. I have to work through my chain of command. I have to make sure I play the part where I'm not overstepping, which was a skill in itself, but I still had those resources. I could say oh, if we're having a problem or something comes up with security, I know I can call the director of security or manager of security, hey, can you help me out? Or what should I do?
Mm-hmm. Okay, awesome. And what advice would you give to someone that is starting to work in the fast-paced healthcare environment?
Never give up. Even if you make a mistake, do not let that deter you. Here at Salem Health, we say mistakes are golden. We run by lean and Kaizen. So if you find a mistake, yes. You know why? Yes, we can fix it. You don't have to be perfect when you're going into this field. You do have to network. You do have to network and make sure people know your name in a good way. And, be you, be candidly, honestly you. And I tell people in this world, it's not also just at work, but it's outside of work. Mm-hmm. If your coworkers are going to an event or going to dinner, oh yeah, I want to come, or plan to get together or hang out, because that plays a role in what goes on and what happens next. So, but bottom line, never give up, because I could have gave up at the 11 no's, but never give up. And never be afraid to step out of your comfort zone, because here in Oregon, I stepped out of my comfort zone entirely and had to refocus and recenter myself.
Yeah, and that is great advice. So you touched on just now Kaizen and lean management. So what are these two things?
Oh my goodness. So they are most of the time, if you're in this field or project management, anything, you heard of Six Sigma. Mm-hmm. And Six Sigma, which is basically the overall parent of Kaizen and Lean, is basically the elimination of waste. So Salem Health began a journey of Lean and Kaizen around 10 years ago. Very tough in the beginning, but they have it down packed to a science now. And Lean and Kaizen is just that. We want to eliminate waste while increasing patient quality of care. And we want to make sure we're doing the right things in the right proper way. So when we say elimination of waste, we are talking about time, we're talking about space, we're talking about distance, we're talking about, almost anything that we would consider part of the waste, whether it be redundant work or triple work on other piece of parts, or, over usage of things, or, maybe you order too much You know, you may have ordered too many supplies and your supplies expire. You done wasted money. So how can we find the perfect lean spot to say like, okay, every month you order this amount and you won't run out. We'll still have enough to service the entire system, and financially it will save you. So lean and Kaizen, I'm saying they are a way of being when it comes to this organization. You know, like I say, mistakes are golden. Like I found out that one of the things that was a mistake, or well, not a mistake, one of the things was a problem was sometimes there's no standard work. Everyone's doing something different. So by simply pulling in the right groups of people, going through your, we call it a 4-step, where you identify the problem, you know, work out different solutions for the problem, you get to the root of what the real problem is, and you work on ways to digest that root, or water it, make it go away, however you want to say. And that teaches you so many things as leadership, because I'm like, okay, we have a problem. What I thought was the problem really ain't the problem. What is really something further down the line. And if I address that, then it will fix everything else as the time go on. So lean and Kaizen they're that way of saying, I want a smooth, efficient ship. And it comes from the Toyota industry, because Toyota, hey, if you had a Toyota Camry, that car would last you for decades. And that's the principle that has transferred over into healthcare, as those lean and those lean tenants and those Kaizen ways of let's smooth out our problems, catch them as upstream as possible, and fix it from there. And I encourage anyone, you know, our organization, we don't do Six Sigma, lean belt, or those other things. But what we do is we provide a lean training classes. We have what we call the Physician Leadership Institute, which is I'm a graduate of, which is like 6 months of intense training around lean, you know, what's currently going on in the industry, trends, and all these different things. And they set their leadership up to say like, hey, lean and Kaizen are a way of life. They are who we are as an organization. And anyone can do it. Anyone can do it. So you could go out there right now and begin to look up like lean and Kaizen and begin to niche it and find a way of implementing into your daily work that say like, this is for me. You know, I can see how I can reduce waste, or I can reduce the amount of clutterness around my desk, or I can, you know, it used to take me 30 minutes to find to fill out a process form. Now it takes me 5 minutes. You know, that's a 25-minute saving, which, you know, we equate the dollars and overall, you know, hit up from there.
Okay, yeah, and that definitely makes sense. And yeah, it is something that you hear a lot about in health systems and everything like that. So did you find any like challenges going from your MPH going into health system? Like, did you find like there was any lack of like specific knowledge that like kind of hindered you in your initial steps of your administration fellowship?
Yes, in ways, because an MPH in the healthcare space is it's still new to a lot of people.
Mm-hmm.
So most of the time when you have a fellowship or managers, directors, supervisors, they have a MHA or MBA. Mm-hmm. But now you're starting to see MPAs, Masters of Public Administration, and MPHs in these spaces. So some of the caveat of having an MPH with this is I may not know everything I need to know about operations. Mm-hmm. Or everything I need to know about a system. And when I interviewed, I was honest. I may not know everything, but isn't that the purpose of a fellowship, to teach me? So I think the first thing is like, it was a weakness not knowing fully some of the business things that go on with a health system, or how billing and coding and revenue cycle play a part, or even facility management and regulations, how all those play a part in it. But, you know, if you have an eagerness to learn, it's easy to learn those things. You know, that should not be, you know, you may have a master's in education. And if you're interested in going into healthcare and you have a certain skill set, you can do it. So if you have a lack of knowledge, like I did, I went and learned. I went and saw it firsthand to like I see this as a weakness and I want to improve upon it.
Yeah, and you definitely have to acknowledge that it is a weakness before you can improve upon it. So that's awesome that you do that. So what's a challenge you see coming down the road for health systems?
One of the things is COVID-19 has proven that a lot of things that health systems said they could not do, they can do in an expedient amount of time without reducing quality of care to patients. So now health systems have to realize barriers that we have placed for ourselves, we can now remove them. You know, one of the biggest things that came from health systems around the nation was telehealth. You had doctors, I'm not doing telehealth. COVID-19 hit, you have no choice. Telehealth is the new wave. CMS is now doing higher reimbursements on telehealth. They're seeing they're legitimate, that we're still seeing great things coming out of these telehealth visits. You know, and telehealth is a great thing, especially for those that can't leave home. You know, if they have internet access, you know, that is one of the barriers. But if they have internet access, they can, in their busy day, they can still be at home, take care of mom, dad, the kids, and do a telehealth visit. So realizing like the barriers we had, they're no longer feasible, you know, knock them out. We can do the things that we say we cannot do. And the thing of realizing that sometimes these spaces are not equitable to those that don't look like the majority. And there is still work that needs to be done to ensure that everyone is treated the same, or if they're not treated the same, they're given that equity in order to bring them up to that level where they are treated the same. We understand where they're coming from. You know, now you're seeing health systems push out diversity inclusion statements, pushing out this, push out that. And I'm very key on it. I'm like, okay, you have a statement, but your leadership is not reflective of that statement. Your board members are not reflective of that statement. Your managers, directors, they're not, you all say this, but you don't have LGBTQ. You don't have minorities or African Americans, Asians, Pacific Islanders. You don't have those, or you don't have those groups in your leadership. So what can you do? And I think that's one reason I'm proud to work at Salem Health, because they saw that problem and they began to tackle it. They said, okay, we're right. We're going to make the intentional move to increase those things in certain areas. So, and one thing health systems are going to say is, we don't have the data. We don't have the data to prove that having a minority or having this in there is going to affect quality of care. Yes, we do. We have decades of data that proves the more diverse your organization is, the more financially safe they are, the more financially profitable they are, the higher the quality of care, the more productive you are. So the information is out there. So the old boys club in healthcare, get ready to go away, because my generation is coming in and we're saying no longer are these things that you all say can go on, okay? No longer are limiting the Medicaid panel. No longer saying like, hey, we're not going to hire this type of doctor or that type of doctor. No. We're going to intentionally, if we know we have a high African-American population, that's not here in Oregon, but other systems, if we know we have a high African-American population and they specifically come to this clinic all the time, let's see what we can do to recruit a African-American provider or a minority provider, because we know they'll feel safer. We know they'll most likely come to us, which is going to, have a snowball effect and benefit us. And I tell people, having diversity in health administration is just as important as having Black doctors. You can have as many Black doctors as you want to, but I tell people, I say, okay, but look at the bottom of the doctor's check. It's a CEO at the bottom, right? Sometimes it's not a doctor. That is a healthcare administrator. They're the ones signing your check. They're the ones making the guidelines. They're the ones deciding the policies. They're the ones doing the hiring practices. They're the ones dictating what type of insurances we're going to take, or how much of the, this or that we're going to do, or how we're going to recruit. Healthcare administrators are making those decisions, and they're the ones making the schedule. They're doing so much. I was like, it's just as important to have us. It's just as important, because we can't fill one hole over here when another gushing one is coming out.
Yeah, absolutely. So going back to earlier, you spoke about how you do healthcare policy, mentorship, and teaching. So do you just want to talk a little bit about that?
Yes. So one thing, when people ask me what I want to do in life, the only thing that I can see clearly is I want to become a collegiate professor because I want to train the next generation of leaders in public health and healthcare administration. That's the only thing I see going forward. And I expressed those concerns to my mentor, Dr. Wendy White, and future Dr. Muhammad, Amoya Muhammad at Tougaloo College. And I said, well, hey, I'm interested in this. I did some lectures while at Morehouse College, teaching undergrad there. I did some while I was at Morehouse School of Medicine. I say, I know I can do this. I know I can break down this complex ideology or these things to where they meet the mindset of students. And I saw a need in the Jackson Heart Study program. I said, well, we don't talk about policy and healthcare administration. I didn't know about those opportunities until grad school. We need to introduce that. And they said, well, okay, we have our general public health course. Do a lecture however long you want. I said, huh? They said, yeah, you talking the talk, walk the walk. So I said, well, okay. I did a guest lecture over the summer and they said, okay, well done. We're going to invite you back to do a fall session. I said, okay. So I carved out a week where I talked about health administration and health policy. I broke down what they are, why they're important, how many of what the demographics of the fields are, why it's important to have us in there, and some of the basics that you need to know, like how a hospital structure is set up, why a policy is so important. I said, you all may look and think these things are two different things, but they're not. If a policy goes through Congress and it passes and it says healthcare, like the Affordable Care Act. The Affordable Care Act has some heavy policies in there, and it changed the structure of health systems nationwide. Now, health systems had to participate in a community needs assessment. Now you had to do a community needs assessment. And I say things like that impact you. So there was a policy in Mississippi that focused on teenage pregnancy and prevention in like teaching in high school. The bill was shot down. I said, but you all we're in Mississippi and you all didn't know about it. I said, if you all knew about this could help reduce the pregnancy rates in Mississippi, which can improve the quality of care, which can reduce the number of pregnancy deaths that we have for pregnancy and teenage mothers. So you have to look at these things holistically and how they come together. And I did the lecture. I gave them assignments. I enjoyed myself. I really did. And they gave presentations around a policy. They went out into the legislative sessions. They found a policy. And I said, I want you to take a stance on the policy. Do a policy memo, defend why, I should vote for this policy or why I shouldn't vote for this policy. And the things that the students did in a matter of days were amazing. And it helped open their eyesight to, okay, this is another field I can potentially go into. And a few students reach out from there. I have a one mentee, Christian, who said, I want to do public health and I want to do healthcare administration as part of that. I don't want an MHA because that may limit me just to healthcare administration. But if I do this public health and focus, I can still go do epidemiological work. I can still go do public health work. I can go work in the government. I could do CDC work, local department government, statewide government. I can still do those things if I have this skill set that I'm learning from policy and healthcare administration. And the bulk of that is leadership qualities. I say, y'all, it's mostly leadership. It's around how you're talking to people or how you're doing the work. All that comes from, what you learn and how you use your skill set and the leadership qualities.
Yeah, definitely. And thanks for sharing that. So I know you said that you want to go on to teach and I guess mold the next generation of public health and health administration leaders. But what is something else, or where would you like to see yourself in the future other than that, if anywhere else?
So that's such a hard question because I do not know. I follow my gut. Some people have a vision. They know what they're going to do. I used to do that, but then it didn't work out. And a quote came to my mind as old school is like, God laughs at man's plans. And he was laughing at my plans. And I was like, you know what? I'm just going to follow my spirit and my intuition and go. And it has not failed me yet. It guided me to Morehouse School of Medicine. It guided me up here. And it's guiding me throughout. And I think it's okay for people not to know what you want to do. They say, well, Michael, how you 26 and how you 26 doing all these things and you still don't know what you want to do? I just don't. I know my areas of passion, HBCUs, public health, health administration, mentor, those are my passionate areas. I know that, so if I end up becoming a director of a community engagement center, or if I end up becoming a C-suite leader of a health system, or if I end up just under a bridge somewhere, I'm still going to, do what I can to make sure I incorporate my passions into that.
Okay. Yeah, and that makes a lot of sense. And yeah, that I definitely think that's a great way to think of it, because and especially I feel like in public health, there's just so many different things you can do, so many pathways. It's a bad thing to kind of try to limit yourself, I feel like, because you might know what is out there for you, or what will really resonate with your skill sets until you actually get out there and do it.
Yes.
Yeah. So moving on to the last section of the show, the Furious Five, 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
To do your research, to make sure you pick an institution where they're going to mold you and grow you and really give you the right connections and ensure you land a job. And to remember why you're doing this. If you're going into public health and you don't have a passion for it, do not waste your time. If you know you have a passion and you want to save the community and you just don't know how, public health is the way, because they will give you the tool sets in order to impact every facet of everyday life. When I mean public health is in every facet of everyday life, we are in every facet of everyday life, from housing to road work to anything you could think of. You can relate it back to public health.
Absolutely. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Woo, them some big shoes to fill. But honestly, I would say step out of your comfort zone. And if you see my path was a fellowship, because I knew I wanted fast track, but if apply to those fellowships or start working at a hospital, when you start working at that hospital or government organization, make it intentional. You want to move up and develop those relationships to move up. Mm-hmm. And to me, I tell people it's like, hey, we're all unique. What I'm doing may not be for everyone. What you're doing may not be for everyone. But as long as you are happy and you're passionate about it, it will all work. I am happy to get up and go to work. Anybody know Michael? Michael is normally late. I am up at work. Like, hey, if we have a 7:30 meeting, I'm there at 7:30. If we have a 6 o'clock meeting with providers, I'm there at 6:30. I'm there at 6 o'clock, and I'll probably stay late just to ensure, because I know what I'm doing is going to help the public. It's going to help my team do their job, and if they're doing their job right, the quality of care. I think about my grandma. I'm like, ooh, I want my grandma to go to a shoddy hospital and try to get care. Let me do my part to make sure they get the proper treatment.
Awesome. Number three, what's something you are working on improving in your life right now?
I am working on, so I'm a networker, but I only do the first phase of networking. And this catches so many of us. The second phase is intentionally following up. The first phase is meeting people. I'm great at meeting people. Oh, you catch me in a room, I work a room, talk to people, get the business card, but I'm terrible at following up. And I have made it intentional to myself to follow up with people that, you see on social media or Facebook or LinkedIn. Follow up with them, check in how they're doing, schedule a meeting, get advice for them. And also, I had to say, like, Michael, you want intentional mentorship. Like, okay, if I really want to grow in this field, I need to find like a C-suite African-American who's in this field, who can relate to some of the things I want to go to, and pursue that mentorship with them and show them not only what they can bring to you, but what you can bring to them, where it's more profitable. So this season, because I call them seasons, this season, I'm just working on being more intentional and focusing more on not only my career growth, but my personal growth.
Awesome. Number four, professionally, do you recommend anything?
Join organizations. Join organizations like, I'm a part of the American Public Health Association. I'm about to join NACI, the National Association of Healthcare Executives. I do National Alumni Council with Tougaloo College Fund. I'm a part of them. My Tougaloo College National Alumni Association, I'm a part of them. I'm a part of something bigger because they can help me out, or they can point me in the right direction, or I never know what I'm gonna come in contact with that they can help me out with. So join an organization. Don't be afraid. Don't single yourself out. Don't be afraid, and don't be afraid to ask for help. I'm in an organization. If something goes on in APHA, I'm part of the healthcare administration section. I know I can reach out to those leaders and get their thoughts. Like, hey, I ran into this problem. What do you all think? What should I do? What would you do? So join an organization. Make yourself known. Make sure you shine bright. What Rihanna say? Like a diamond. Yeah, like a diamond.
Absolutely. So last but not least, where can people connect with you?
All right, you can connect with me on LinkedIn and Michael J. Cleveland. I'm on Instagram as _MJC94. I'm on Facebook as Michael J. Cleveland. If you put Oregon beside that, I'm probably gonna be the only one that pops up. I don't have a Twitter. I wish I had a Twitter. I probably need to get on Twitter. But you can reach me on those sites and by email. I tell everyone I am, when I find someone that's intentional about being a mentee, because I don't waste my social capital. I send people through a ringer to figure out, like, are you intentional about this being a mentee? If you want to reach out for help, reach me on those sites, or you can email me at michaeljcleveland94@gmail.com. And I'll be happy to help you out, or, do what I can to connect you with the right people in your area.
Yeah. And speaking about that, what do you look for in a mentee, as you said?
Honestly, someone that's serious, someone that's really serious, someone that just don't want to hand out. Like, okay, I know Michael's in a healthcare administration fellowship, or Michael's a part of this work, so I want to use his network to get somewhere. I look for someone that's hungry, that knows they need guidance, that's like open and willing to, constructive criticism or whatever, and who can help me grow. Could be like, well, oh no, I may have thought of it like this, or where maybe I should do this different, or Michael, maybe you should do this different, or how you communicate may be a little different per person. I truly believe in that two-way street. So if you're just someone who would want, Nene Lee said, sometimes I'll treat you like a one-night stand, one and done. If you're trying to one-night stand me, don't do that. Don't do that, because I'm going to catch it. I'm going to smell it. And I'm be like, nah, I'm good. I had a serious conversation with someone one time. I said, you're not serious. You really don't want to do this. So when you serious, come back to me and I can help you out. Because all I have in this word is my good name, that good Michael J. Cleveland. That's all I have. And if I put that behind you to support you, just like my mentors, like Dr. Waldrop, Dr. White, just like, like they did, they put their name behind me. I got to make sure it's going out there and it's some good capital.
Yeah, absolutely. And that makes a lot of sense. Well, thank you so much, Michael J. Cleveland, for jumping on this podcast. And I know that people are going to definitely take a lot of value from this. And I just love your passion. And I'm just looking forward to seeing where your journey takes you.
Thank you so much. And I want a special shout out to you, because you are doing an amazing job. You're one of the few trusted, credible sources I trust on social media. I'm like, if he said, it must be true, or like, okay, he's doing the right thing there. I'm like, I can listen to him. But thank you so much for having me.
Yeah, definitely my pleasure. Well, I'm glad to have Michael J. Cleveland on the show today. I just love his energy. It's great, some great energy, some great insights, and I just think he's going to be doing some really great things in the health administration field. And I think that as I just keep on thinking about it, I just keep on thinking that we need more MPHs in health administration to really get that population health focused on a systems level kind of approach, so we can really have public health in these health systems. So I just look forward to having these continued conversations and how we could move forward these types of conversations and movements. So I hope that you enjoyed this episode. Definitely subscribe, share, leave a like, leave a comment. I appreciate you all, and I will see you all who see me next week. Public Health Millennial out.